Continuing on with sensory, or HEENT, we have visual impairments. So we have myopia, which is nearsightedness, hyperopia, which is farsightedness, and I made them like bigger and smaller so that you could visualize and remember. Astigmatism, uneven refraction of the lens or like curvatures, and anisometropia, which is different refractions in each eye. And when it comes to strabismus, which means misaligned eyes, there's two kinds. There's esotropia, which is like crossed eyes, inward eye turning. And there's exotropia, which is outward eye turning. And exo, outer, easy to remember. We also have cataracts, which in her slides show developmental delay, and it includes the absence of red reflex and the opacities of lens causing peripheral vision loss. In glaucoma, you have increased ocular pressure in eyes, and excessive tearing and blinking can happen. The red reflex turns into gray or green reflex. For hearing impairments, they affect speech. So the first sign of a hearing impairment is a lack of a startle reflex, and babies are checked for hearing prior to leaving the hospital after birth. But even if they're normal, they can develop the hearing delays. So if a child is not developing good speech, check their hearing. We have strep throat, a sore throat because of the Streptococcus A. It is very contagious, and it can turn into something very serious, lifelong complications. Scarlatina, I was seeing pictures online, like a lot of like red bumps, so I just drew red bumps. We have kidney and heart complications, and to treat, antibiotics over 10 days. Usually amoxicillin is the first choice, and it's 40 milligrams per kilogram twice a day. For nursing care, take all the meds, take care of your toothbrush or replace it, then Lysol wipe all the handles, doorknobs, phones, and tech equipment, and do not share food or drink. With allergic rhinitis, aka hay fever, it's nasal membrane inflammation. So the signs and symptoms are congested nares, inflamed turbinates. So when I was looking it up, like this is the nose, and like the two nostrils, when you like look inside, they were kind of like inflamed. I don't know, but anyways. And clear discharge. It can happen seasonal or year-round, and it's caused by the food or environment. The meds used are antihistamines, nasal spray over the age of 4, nasal saline, and good nasal hygiene. With nasopharyngitis, which is the common cold, it manifests as a sore throat, low-grade fever, then morphing into nasal congestion, sinus pain, and cough. And the exams say that they're normal except for the ones up here, so like low-grade fever. It's usually 5 to 7 days long. It improves after day 4. And the meds are over-the-counter cough and cold formulas, depending on their age.